By their nature, public emergencies turned to necessitate the release of large amounts of resources in a short space of time, necessitating higher levels of accountability with the greater complexity which comes in handling increased expenditure. In efforts to contain the global pandemic COVID-19, the Zimbabwe Minister of Finance and Economic Development announced that the country received $960 million in special drawing rights. Unfortunately, the massive procurement program created unprecedented opportunities for corruption. TIZ in March 2020 wrote to the Ministry of Health and Childcare requesting a detailed distribution matrix relating to funds and aid meant for COVID-19. TIZ approached the High Court of Zimbabwe, which ordered the ministry to release the information in the public interest on the 15th of September 2020. TIZ thereafter engaged the ministry to abide by the court order and was subsequently given the documentation relating to the distribution of the related funds on 16 November 2020. The common forms of corruption observed in the report were found to be procurement malpractices, theft of essential medicines and subsequent diversion to grey markets, bribery, nepotism or favoritism, and false referrals. The abuses in the usage of COVID-19 relief funds were corroborated by other sources. The 2021 Afrobarometer study report assessed that 90% of surveyed citizens said that they did not receive government COVID-19 assistance. 54% of the surveyed population in the Afrobarometer study report believed that the bulk of the resources meant for COVID-19 response were lost to government corruption. The same address in Buhera district was exposed for allegedly being used by 1,000 beneficiaries as a residential address for claiming COVID-19 relief funds. Research by TIZ in 2021 shows that the majority of the 2,583 citizens surveyed on bribery in the public sector expressed low levels of confidence in organizations tasked to tackle corruption. 69.3% expressed high awareness of the existence of these anti-corruption institutions. 70.1% preferred to report to family or friends instead of competent authorities when asked by public officials to pay a bribe for a service. Parliamentary oversight is a powerful mechanism to ensure that the government guarantees citizens the right to health. Parliamentarians play an essential role in health by enacting legislation, approving budgets, and mobilizing resources, and providing oversight to ensure government accountability and transparency. Electronic government procurement is one such mechanism for legitimizing transparency, accountability, and integrity in public procurement, e-procurement. The reduction in corruption achieved through e-procurement is mainly due to the elimination of human contact in public procurement. Parliament cannot go it alone in tracking expenditures on COVID-19. In this regard, Parliament must collaborate with the private sector or specialized CSOs tracking such issues on behalf of various constituents to strengthen their oversight on COVID-19.